Welcome. You're listening to Ask the Doulas, a podcast where we talk to experts from all over the country about topics related to pregnancy, birth, postpartum, and early parenting. Let's chat.
Hello. This is Kristin with Ask the Doulas, and I'm excited to chat with my friend, Dr. Annie Bishop of Rise Chiropractic Wellness. Welcome, Dr. Annie.
Thank you so much, Kristin. I'm so pumped to be here again.
I'm excited to chat with you. It's been a bit. We've had you on over the years, multiple times, as well as Dr. Rachel. But our topic is all about the importance of overall chiropractic care during pregnancy, but especially focusing on the Webster technique. So Let's dive into that.
Awesome. Thanks, Kristin. So I really wanted to talk about Webster technique, like what it is, why people seek us out, and why it's so important as a preventative measure for your pregnancy. So the first thing is Webster technique was started by Dr. Larry Webster, who is a chiropractor, and he developed this technique that was specific to the anatomy of the pelvis. So to help moms during pregnancy, to make sure that everything was in good alignment. So that's been taught now over the last couple of decades to a lot of different chiropractors. So when you're searching for like prenatal chiropractic, Webster technique is really the certification that you want to check for. So that has been kind of going on with a ICPA, which is the International Chiropractic Pediatrics Association, for several decades now. They're the ones who do the training. Both Dr. Rachel and I have taken that training, as well as some other advanced perinatal techniques and stuff too. So it's really important at helping support women during their pregnancy and help support their bodies. And so I wanted to go in depth a little bit with what Webster technique is, what it's actually looking for, and why it's so important from like a neurological aspect, from a overall like body tone, how your biomechanics are changing aspect. So that's what I wanted to focus on today.
Beautiful.
So, yeah.
Before we begin,
sure.
You did mention some of your certifications as well as Dr. Rachel's, but give us a bit about your background.
Yeah.
I know you have many certifications, and why you chose to work with women in a childbearing year versus all of the different focuses and types of chiropractic care out there.
Oh, thanks for that question, Kristin. So both Dr. Rachel and I went to Life University. We actually went at different times. She's my best friend's oldest sister. So after she graduated, she told me where to go. So I followed suit. But while there, you take some like family style, like pediatric and pregnancy courses kind of in the curriculum. And
Sure.
Then you can take like some optional ones if you're really into it. And I think it was during like those ones when I was learning about like neurodevelopment and all of that, that I became really interested in this idea of helping babies and helping with that neurodevelopment, making sure babies are on the right track, and the impact that you can have in a kid's life that way and in a person's life. And a lot of that initial like help with infants starts in preconception through pregnancy. So doing like the prenatal and pregnancy support was really important aspect of that, and like helping moms just have their best possible pregnancy. I mean, both Rachel and I are women. We care a lot about women's health and are very like huge proponents of just women's health in general, and like having good doctors and not, dismissing women and being really supportive of their whole journey. And so that became really important to both of us. And then when Rachel got pregnant with her twins, we realized how absolutely important and vital it is to have good chiropractic care throughout the pregnancy, and how supportive that is.
Absolutely.
Yeah.
Not only with relieving discomfort, especially with twins, but certainly positioning. It is so important for vaginal deliveries to have both twins head down. As I know you worked on Dr. Rachel.
Yeah, absolutely. And she carried those twins to 39 weeks.
Yeah.
Had 2 8-pound
I was her
babies,
doula.
so.
She was amazing.
Yeah. So it's so important. It's great. Just support for the mom's body, for the position of the baby, for just all of these factors that go into like having a good birth. And then that also leads the way so much to prevent birth trauma, to prevent like intervention so that baby has the best outcomes too. So that's why we're so passionate about what we do.
So if our listeners see a general chiropractor and then they become pregnant, is that something that, you temporarily switch over to a Webster Certified Chiro, or is there any co-care if they have this long-standing relationship?
Oh, that's a really good question. It's up to the comfort of the individual. I would say if your chiropractor doesn't have any pregnancy training, I would switch during your pregnancy. There's just a lot of important things and changes in your body that you want to have someone who is really educated on it and really prepared for it. And we have a lot of moms that will come to us just during their pregnancy and then go back to their old chiropractor afterwards, and take their families there and stuff too. We have no problem doing that. I think it's kind of just like medical doctors. You have different specialties and some people are really good at some things. And I think that that's a really important thing when it comes to chiropractic is we should really focus on each other's strengths and give people the best care possible. Right. So having somebody who's really well trained in perinatal care during your pregnancy is going to be so much more supportive. And then switch back to your old chiropractor afterwards. I think that's great, especially if you have a great relationship with them.
Or if your chiropractor is not a pediatric chiropractor, the way your practice is also Webster as well as pediatric, then potentially having a pediatric chiropractor adjust baby and then transition as the child ages to a general chiropractor.
Absolutely. Babies are not just little smaller spines. They have a lot of differences too. So you want someone who, again, knows and is really good at adjusting kids and works well with kids.
So Dr. Annie, what are some of the top reasons that your patients seek out a Webster Certified Chiropractor?
Sure. Yeah. A lot of times people seek out Webster Certified Chiropractors because they're pregnant, but also because a lot of times it goes along with pregnancy discomfort, what they're feeling, changes in their body, but also because baby's malpositioned. I feel like that it goes along with the Webster technique. Usually when baby's not in the right position, moms will start seeking out Webster technique certified chiropractor. And so I want to talk about, all of that too, how it all works together. So Webster technique is kind of based on ways to prevent dystocia, which is difficulty during labor. And so if we go into Williams Obstetrics is the textbook that OBs use, in their education and in their schooling. And there's three main causes of difficulty during labor. There's power, passage, and passenger are the three things that they talk about. Power is talking about your uterine contractions, how well neurologically your body is able to communicate. So the uterus is a huge muscle and it gets its innervation from the upper lumbar and also from the sacral plexus too. So it gets those nerves from the spine are coming and talking to the muscle of the uterus. And so the power component of that is really making sure that there's good neurological communication there, which ties directly into chiropractic. We want to make sure everything's in good alignment so that that communication can work well, so that when your uterus and all the muscles are contracting, it's all working together symmetrically and working together really well. The passage is looking at the pelvic opening and the shape of the pelvis and how all of that moves during pregnancy too. During labor, the pelvis kind of opens up, the sacrum kind of kicks back. The pelvic floor muscles have to be pliable and movable so that the baby can have the best chance of going through the birth canal. And so if there are subluxations in the pelvis, that's really what Webster technique is looking at, is how the pelvis alignment is working, how everything's working together. Because if ligaments are tight on one side, if pelvic floor muscles are tight on one side, that's all going to cause more intrauterine constraint, which is also going to lead into the next one, which is the passenger, which is the baby trying to come through the birth. So if there is twisting in the pelvis, if there is intrauterine constraint because of those ligaments or muscles, baby's going to have a harder time getting into the right position and getting into that head down, ready to go position. So those are kind of the three main components, and Webster technique addresses each one of those in kind of a different way. It's chiropractic is working with those subluxations to make sure there's good neuromuscular communication. We're making sure everything's in good alignment so baby has the best chance of doing the right thing. And then we also work on like ligaments in the belly and stuff too, to just give baby optimal room, because innately they should be able to get into the right position.
Right. And what is the best time in pregnancy to start seeing a chiropractor?
Oh, I would say the earlier the better.
I would agree.
I just think we have the best outcomes. Like the earlier you start, there's so many factors to chiropractic too. Like it's not just about like being uncomfortable or being like having the correct like biomechanics, making sure that things are in alignment, but there's so much to the stress component of like that sympathetic and parasympathetic balance in the body, like making sure your body is recovering well and that you're just functioning as well as you can. So I would say, I think everyone should be under chiropractic care, everyone with a nervous system, but especially like early in your pregnancy, you're going to feel so much better. Your body's going to adapt so much better to the stresses and the challenges of pregnancy. And then we can just support you all the way too.
Exactly. And so for our listeners who may be seeing a physical therapist, how does that relationship connect between a Webster Certified Chiro and maybe getting certain exercises from their physical therapist to relieve discomfort?
Oh, I think that's awesome. I love it when people are so invested in their pregnancy and they have like all of the tools. It's the best. Like pelvic floor therapy is super important too, pre and post. But also, working with a PT I go to a PT like monthly just to like keep my body working the way it should, to make sure I'm doing the right exercises and balancing my muscles and stuff too, in addition to getting adjusted weekly. I think both are so super important and they work so well together. So if you have a PT and that they're working with you on strengthening, the beauty of strengthening the muscles in a well-aligned position is just like chef's kiss, just like perfect. So they work so well together.
Agreed. I do feel like there's a misconception that if someone is seeing a chiropractor, they don't need PT. So I'm glad that you cleared that up. Or if they're seeing a physical therapist, then, and obviously some people, if it's self-pay or limited HSA funds or insurance only covers so many visits, that they might really try to optimize their budget.
Yeah.
But as someone who is non-medical, it makes sense for me if a client has the time and funds or insurance to utilize all of the options for support that they can.
Oh yeah, absolutely. And like realistically, there's a lot of different things that you can do, and really finding what works for your body and who's willing to work with you on it, I think is the best option. So like we do those scans in our office that are, again, no radiation. They're all just like functional tests, and we give our recommendations, but we're always willing to work with people if they're like, well, I'm doing this and this also. It's like, great, this is supportive care. So like, let's see what we really need. And then if you're doing all these other things at home, we can kind of modify that, because you're already putting yourself a step ahead of someone who's just like only doing this one thing, or it's a little different because, again, things work synergistically. So.
Right, exactly.
Yeah.
And I would say, certainly I've sent some of our clients to you if baby is breech or is malpositioned for those positioning issues or, again, discomfort. But there's also some of those last minute calls that you would get for someone who maybe has a VBAC and wants to optimize their chances for a vaginal birth after cesarean, or someone who baby's measuring big and they really want a vaginal birth, so they want to get that extra support from a Webster Certified Chiro. What else are you seeing?
Hey, Alyssa here. I'm just popping in to tell you about our course called Becoming. Becoming a Mother is your guide to a confident pregnancy and birth, all in a convenient 6-week online program. From birth plans to sleep training and everything in between, you'll gain the confidence and skills you need for a smooth transition to motherhood. You'll get live coaching calls with Kristin and myself, a bunch of expert videos, including chiropractic care, pelvic floor physical therapy, mental health experts, breastfeeding, and much more. You'll also get a private Facebook community with other mothers going through this at the same time as you to offer support and encouragement when you need it most. And then, of course, you'll also have direct email access to me and Kristin, in addition to the live coaching calls. If you'd like to learn more about the course, you can email us at info@goldcoastdoulas.com or check it out at thebecomingcourse.com. We'd love to see you there.
Those are big ones. I mean, we do get the 36-week, my baby's breech. We just found out on ultrasound.
Right.
What do we do? And it's okay, we're going to do probably close together visits, just try to optimize whatever time we have. And also send you to somebody who does body balancing technique, just we're going to hit the ground running and just try to optimize whatever time we have. Obviously more time is more beneficial, but we're always kind of willing to work with those situations because we get it. A lot of times you don't get the ultrasound until that point. And so
exactly.
You don't
and
necessarily
then you need to
know.
make decisions.
Yes. Exactly. But we're always willing to support any of those kind of game time things. But yeah, I would say that those are pretty big ones. You kind of nailed on the head with the breech baby positioning. Feedback support is huge. We have we have a high success rate with VBAC support, which is so exciting. There's also great care providers in town too, willing to do VBAC. So I think that's awesome. And yeah.
And then even an induction pending, wanting to get your body as ready as possible. If, that induction conversation comes up with the provider and you aren't seeing a chiropractor, similar to what you described with the breech baby, trying to get in as many visits as possible before, say, the induction date would be beneficial.
That's a great point. Inductions are stressful on the body.
Yes.
And so the better adaptability and the more ready your body is to have a baby, the better outcomes you have with the induction too. So that's a really, really good point too. Just again, supporting moms, getting them as ready as possible so that their body can handle what's coming.
Right.
Mm-hmm.
And then certainly reducing headaches or, balance issues. They're just I could name off 20 reasons.
I know. Yeah.
Why?
Or the SPD,
I said my clients
no one knows what to do with the symphysis pubis dysfunction, which is awful.
Right.
But we can adjust it, which is great. And it helps a ton. So if it hurts when you go up the stairs or when you try to put on your pants one leg, it helps a ton. But yeah, I mean, that's the benefit of your body working more efficiently is a lot of those symptoms go away. And it's not just about the headaches or the pain and stuff, but it helps a lot with those things too. So let's not discount pain is a huge motivator for sure.
Yes.
Yeah.
And then also in a women-owned practice, supporting women, when I go in for adjustments or to work on the diaper drive with you, I hear it's almost like confiding in that close relationship you would have to your hairdresser. It's you are following their journey. You're offering emotional support the way a doula would. It's truly a sense of community.
Oh, I think that's my favorite part of our practice is we do the open adjusting. So there's so many mom conversations that kids will be playing in the corner and moms are just chatting oh, what do you do about this? Where do you guys go to play? What parks do you just little conversations like that between, and I just love to be witness to that. But yeah, that's going with moms through. We have a lot of second and third time moms right now that we find out so early in their pregnancy because we're one of the first providers they can tell, one of the first people they can tell. We're just so thrilled for them because a lot of them sometimes are it's taken a little while to get pregnant again and stuff. And so we celebrate that with them. We work with them through their pregnancy journey. They can tell it. We're no shame in our office. You can tell us literally anything and we're just here to support it. And then getting to enjoy that birth, getting to go through all the highs and lows of pregnancy, all the highs and lows of motherhood, and just create a community around that is just, I love it so much. I love that aspect of our practice. And that's what just keeps us motivated and keeps us wanting to do more and more of this work.
Yes. And I think your practice is unique in that you do home visits and you do have that follow the journey from pregnancy to early parenting with pediatric aspect of your practice.
Yes. And yeah, home visits are so fun. Like getting to meet baby. Sometimes it's before a lot of the other family members get to too, which is such like what an honor for like a mom that we've helped supported her pregnancy to then be like, here, like adjust my baby too is just, yeah, it's such a tremendous honor to be a part of their lives like that. And yeah, I love the home visit. I think it's so fun. I feel like an old timey doctor, like bringing my whole kit over to someone's house. So that's a big fun part. We always offer those during pregnancy. We love to follow up with moms too. Like we understand that your focus now is on your baby or recovery or any of those things. And so we always like want to check in with you, but not push too much. And so,
Exactly.
Yeah.
And then in pregnancy, if someone's on bed rest at home, of course you can help there since you do home visits.
Absolutely. And even we can, like, if there's home births too, stalled labor, we can come during the labor process. There's a lot of things, even after like a cesarean birth, we can still adjust seated, like there's always ways that we can modify if you're on bed rest. If there's certain things, like if you have an incision, we can adjust you different ways. And we're very flexible with that too.
Exactly.
Yeah.
So what are your final tips for our listeners, Dr. Annie?
Oh, find a chiropractor that loves you like us.
Yes.
And wants to just support you and be psyched about your birth outcomes. I feel like we have such a good just community of birth workers in this area that all feel the same way that we do. And so really, like if you're listening in a different area and stuff, like find a birth team that really cares about you. Grand Rapids, we're so lucky because there's so many doulas, so many midwives. So like Gold Coast, you guys crush it all the time with your classes, with your support, with your like becoming courses to just like support moms as they are and as they show up and love them and just like help them through this challenging time because it's
it's such a vulnerable time. And I do love that you have the all-inclusive model that we do at Gold Coast. We follow families through the first year with our day and overnight support. And so we get to know them on a much different, more intimate level. And you have a very similar model.
Yes. Yep.
So, and you did mention resources, again, for our listeners who live elsewhere. Remind us again on how to find a certified Webster chiropractor in your area.
So anyone who's taken Webster certification and keeps up on it will be listed on the ICPA website, which is icpa4kids.com. It's the number 4. But if you Google ICPA 2, it'll take you to the website. And then right on the main page, it says find a doc. You can type in like your address, your zip code, even just like city name, and it'll populate like who's closest to you. It'll show who's Webster certified, who has a CACCP, which is the certification that I have. It's the pediatric certification. And then there's also a DACCP, which is a diplomate, which I'll probably work on here in a couple of years too. But so those are the different levels of like pediatric and perinatal certification. But if you're pregnant, find somebody who's at least Webster certified. I think that would be just tremendous support for you.
Excellent. And how can we find you? Fill us in on social. I know you're everywhere on social, your website, all of it.
We have a lot of fun on social. We are on Instagram. We're Rise Wellness Chiro, CHIRO. Facebook, same, Rise Wellness Chiro. And then our website is risewellnesschiro.com too. I haven't been on our website in a little while, I guess.
Perfect.
But so you can find us any of those.
Facebook Lives, you have in-office events quite frequently for listeners and clients who are local. So as you mentioned, there's so much going on.
Oh yeah, we like to do yoga bumps and bagels in our office. We've got Jessica, who's a pediatric OT working out of our office. She's doing a bunch of events kind of every third Saturday now. So tummy time support, breastfeeding support, like all sorts of things. Yeah, and then we host Fit for Mom classes and stuff too. So we like to have events in our office for sure and just make it a safe space for moms. Yeah.
Well, thanks so much for chatting with us, and we'll include all those links on the blog, and we'll have to chat again soon, Annie.
Yeah.
Thank you.
Thank you so much, Kristin.
Thanks for listening to Ask the Doulas. For more information about Gold Coast Doulas, visit us on our website, goldcoastdoulas.com. We're also on Instagram, Facebook, and YouTube. If you like this podcast, please subscribe and give us a 5-star review. Thank you. Remember, these moments are golden.